Chris Salada is the Director of Material Management for Salada Health and working every day on our efforts to fight the coronavirus. Chris, thanks for joining us today.
Thanks for having me, Mike.
If you can, first, for the viewers out there who aren't familiar with supply chain or materials management, tell us a little bit about what that means in the organization, what the supply function does for the hospitals.
Absolutely. So our supply chain department is made up of strategic sourcing, which is ultimately purchasing, value analysis, and analytics. And then we also have materials management under supply chain, which is our site-based supply force. So basically we have a materials manager at every site. We oversee receiving, distribution, and inventory management.
So that being said, prior to the coronavirus, I would think that your department and the roles that you guys play often seem like they are behind the scenes or maybe invisible to the frontline workforce, in the sense that, product shows up at the loading dock and ends up on the floors, and people really don't understand, the work that's done behind the scenes. So this public health crisis really has put you guys in the forefront of this. What's it like to be thrust into this situation?
Yeah, it's interesting. What you said is absolutely correct. In the supply chain world, a lot of times we say no news is good news. It means things are running as they should. So with the coronavirus and planning and it's put us in a different position as far as how we normally operate. Normal distribution channels aren't always working to get the appropriate supplies, but we're still having the same strategy as we approach things by strategically forecasting out weeks in advance to make sure that we still have that level of security to the frontline staff to make sure that they don't feel any supply disruptions.
Yeah, and so in particular, if we can talk a little bit about personal protective equipment, really why that's become such a hot focus, not only for your department, but for the front line. So as people have watched this situation unfold, whether it was out west or New York City, or most recently here in Western New York, having masks and gowns and gloves and goggles and shields became a very hot topic. And I know, as you talked about strategically, that was something you guys had been focused on, is continually forecasting out what is the daily burn rate and all that. So maybe start from the beginning, the early part of March when you guys were brought into this, and how you guys started to think about responding to that need.
Yeah, so and actually months ago, we began planning and looking at our current emergency plans that were in place prior to coronavirus, looking at emergency stock, and we went into it, comfortable with the planning going forward. Some of the challenges we run into is a lot of the demand is on the manufacturers and the distributors. So we're having to now focus on looking at alternative sources to be able to obtain the stock that are normal channels. So by looking at a strategic way, it's able to get us the product we need based on looking at the analytics behind the burn rate, like you said, the days on hand, working with the clinical team to make sure that any quick decisions we need to gain access to a product can be turned around quickly so we get it out to the vendor.
So I'm going to ask you to simplify it for those who are watching. When we talk about a mask, goggles, gowns, and things like that, explain what the burn rate is, and then how you guys use analytics to forecast out what we may be short of, what we may need more of.
Yep. So the burn rate is what's being utilized at each site. And, with Salada, we're managing multiple sites and have to look at it from our stock on hand at a corporate level, but then also our burn rate at each specific location. So the importance of this is that we don't have any historical data of what type of usage is required during a circumstance like coronavirus. So we have to track daily, to watch the trends over week by week to see where we're going to be at 7 to 10 days from now, to make sure that, based on stock on hand and what we're utilizing on the front line, that we're prepared for the next 7 to 10 days so we can catch any issues prior to them becoming an issue on the site.
So you are in competition, not only locally or across the state, but nationally and internationally for supplies, and in particular PPE. How have you guys managed through that? What have you done that's a little bit different than you normally do? How do you compete on an international level?
Yeah, so we certainly have teamed up with manufacturers and distribution channels and daily calls, multiple calls a day. Additionally, we've looked through our strategic sourcing department to identify new opportunities that we typically wouldn't go through, but working closely with them and also I think a lot of benefit around the command center and being able to identify a new product that we may not have brought in before, but as an alternative, getting it to the command center, it gets clinical approval, infection control approval, quality approval, and then we're able to act quickly. So by the time we secure something and get it approved clinically, we're able to turn it around within an hour or so, which has really given us an advantage.
So how tough is it to work in this type of environment? Not only from the competition side, but knowing the daily constant clinical needs. How important is it working with the clinical teams, whether it's nursing or quality? What do they do to help you in your daily job, and how can they assist you in your efforts?
The clinical engagement has just been phenomenal from the sourcing team and from the materials team. I'm texting throughout the day, CMOs across the system, quick movement, and that's when we're looking at the supply chain and right now, and knowing that we need to act fast. It's so critical to get the clinical buy-in to make sure that that what we're getting is going to meet their needs. So they've been so accessible, multiple calls daily with our clinical leadership. And obviously my teams on the sites have been engaged with the frontline clinical teams as well. So I think that, with the supply chain and the clinical teams working so closely together has also put us in a great position.
So Chris, you've been involved in some pretty significant announcements in the last month or so, whether it's the 1 million masks that we purchased or the 12,000 shields that we acquired. If you can, tell us what it's like being on the front line of those types of acquisitions and knowing what it's going to do for the workforce.
It's definitely encouraging to see. I often joke when you see the pallet come off the back of the truck and we've secured the product, and we know that the last week or more before that it had been a challenge to even identify where we could get these items. So it definitely gives us a lot of motivation to continue on, knowing that we're able to provide for our frontline staff what they need. So not only for me, but for my site management team, my site frontline staff, we all want to make sure that we're able to provide what the frontline needs. So as we're able to acquire it and as it's in our hands, it certainly means a lot to us.
Chris, as we wrap up, if you can, what's it been like to see the community support for the organization and the donations? I mean, you and I are texting and emailing, sometimes dozens of times a day with organizations who want to step up and help and who have donated, masks and goggles and things like that. What's it like to see the community support like that?
Honestly, it's truly inspiring. It's, I'm born and raised Western New York. I've always had a lot of pride in Western New York. And, during these difficult times right now, it's brought that pride to another level. I mean, I'm 24 hours a day, I'm getting text messages and calls from people who just want to help. It truly means a lot because that we have a whole community behind us, behind our frontline youth, frontline staff, and it's just certainly encouraging to myself, my team, to know that we have a community supporting us behind us.
Chris Salada is the supply chain lead. He's a director of materials management for Salada Health and working on the front line here for the coronavirus. Chris, thanks for your time today.